Hola, hola, muchas gracias por estar hoy con nosotros en este tan importante webinar. Tenemos mucha información muy interesante y hoy nos acompaña un experto en la materia, especialista en inteligencia artificial, Vlad Kozachuk, y tenemos mucha información que compartir. Yo sé que hay mucho ruido acerca de inteligencia artificial, de cómo se usa en salud, los beneficios y demás, pero durante esta sesión vamos a llevar los puntos uno por uno y ver ejemplos reales de la aplicación de la inteligencia artificial en hospitales y centros de atención primaria. Así que espero que nos acompañen hasta el final. Tenemos muchas sorpresas y espero que sea de utilidad para sus organizaciones. Siguiente. Sí, bueno, mi nombre es Anton y bueno, ya algunos me conocen, trabajo para Salud a un clic y Vlad representa la compañía Infermedica. Tenemos un código QR en el cual podrán estar enviando las preguntas durante la presentación y estaremos atendiendo sus preguntas al final de la misma. Ujú. Pues bueno, ¿qué nos trae hoy acá? Hay muchos datos acerca de lo que está pasando con nuestros sistemas de salud en Centroamérica y en general en América Latina. Y hoy traemos un ejemplo que es Costa Rica. Costa Rica recientemente salió una publicación de la ocupación hospitalaria y de de los problemas que representa la situación de los hospitales hoy en día. Y es que para nadie es un secreto que existe una gran brecha entre el primer nivel de atención y atención hospitalaria, en el sentido de que no se están gestionando de la mejor manera las referencias y contrarreferencias. Esto nos da un número alarmante de que más del 52% de las visitas que se están dando hoy en día a hospitales para emergencias no son realmente emergencias. Y lo que uno pensaría que deberían ser las emergencias traumáticas por accidentes de tránsito o eh, relacionadas a asaltos o- o temas de trauma, realmente solo representan alrededor del 3% de las visitas a centros de emergencia. Entonces, ¿qué está sucediendo y por qué un sistema de salud tan exitoso como el de Costa Rica está sufriendo hoy en día con una total saturación de los servicios hospitalarios? Lo mismo sucede con las cirugías. Las listas de espera de cirugías están aumentando. Y bueno, y un poco esto es lo que queremos desarrollar en este seminario, en este webinar, que es muy específico a cómo la tecnología realmente puede ayudarle al médico, al paciente y al sistema de salud a mejorar sus procesos de atención. Volvemos otra vez al tema de la tecnología. Muchas personas piensan que la tecnología va a resolver nuestros problemas y es mágica. Lamentablemente no lo es así. Hay casos donde la tecnología más bien nos crea problemas. Y en nuestro entendimiento de la situación actual de la tecnología es que estamos creando muchas islas de información, islas que no permiten un adecuado navegación y atención del paciente en el sistema de salud. Esto sucede con medicina de empresa, cuando referimos laboratorios o servicios especializados de una empresa al seguro social. Lo mismo en el sector privado, cuando se requiere navegar al paciente en diferentes proveedores. Y al final, todo esto genera que las personas necesitan una solución y al no encontrarla con su médico de cabecera, porque muchos ni siquiera tienen un médico de cabecera, acuden a los centros de emergencia como única alternativa. Hemos escuchado casos donde la gente va simplemente eh, para una recarga de algún medicamento o temas que son posibles resolverlos en un primer y un segundo nivel de atención. Entonces, bueno, sin más preámbulo, los problemas hay muchos. Vamos a dedicar un poco de tiempo a verlo, las soluciones desde el punto tecnológico y cómo implementar estas tecnologías para resolverlo. Parte de la presentación la va a dar Vlad en inglés, así que, bueno, pueden activar su traducción o si no, si hay alguna pregunta lo podemos resolver al final. Listo. Ok. Tal vez la parte que más frustra a los proveedores de salud es que no hay tiempo suficiente. Y tiempo suficiente es porque las visitas no paran. Hay poco tiempo para realmente ver y atender y diagnosticar al paciente. Y uno de los temas que va a desarrollar Vlad es cómo tener toda esta parte de signos y síntomas eh, de una manera inteligente, de una manera en que ya el paciente ya venga con un triage, ya venga con una evaluación autoevaluada o por un tercero o por un profesional de la salud, y cómo esto ayuda en este proceso de atención. Vamos a resolver flujos y procesos o vamos a conversar como una referencia que un médico de primer nivel, como decía en el caso de las empresas, envía a un especialista o una solicitud de laboratorio, cómo este resultado debe regresar y cómo este médico debe seguir su proceso de atención luego de obtener esta información. Y tal vez la parte también que más frustra al médico o al profesional de la salud es que no sabe cómo navegar al paciente, tanto por qué coberturas de seguro tiene, por qué opciones tiene en su cobertura que cuenta y por cuál va a ser la mejor manera para este paciente poder resolver su problema. Creo que estos son los dolores principales que hemos encontrado y bueno, vamos a dar ejemplos reales de cómo esto se puede resolver. Entonces, sin más preámbulo, le doy la palabra a Vlad. Vlad, you're next. Thank you so much for being with us and we are honored for your experience. I know we have been working in Latin America. Vlad ha estado trabajando con países en América Latina y creo que no solo vamos a hablar de la experiencia en Estados Unidos y en Europa, sino también en casos de América Latina. So we're excited for your experience and your knowledge, and specifically how these use cases can be applied for Latin American countries. Thank you, Vlad.
So hi everyone, and Anton, thank you for having me. I'm really excited to share our experience of how Informatica works all over the world and how we help providers, whether it's on the public or private space, um, handle some of the most common challenges in healthcare. So in my presentation today, I will try to concentrate on two key pillars that could help you address the challenges mentioned by Anton before. I will start from care navigation as one of the key issues globally when we talk about healthcare. And then I'll talk about optimization of the consultations. I will try to make it a more, I'll say, interactive session. So I will tell and I will show some of the ways of how our customers currently utilize the solutions and what are the main outcomes that they currently have, what are the outcomes that you could expect. And obviously, I welcome you with any questions you might have. So we'll have some time in the end to tackle all of those. So let's start with the key challenge. So where does it all come from? Why do we have overburdened doctors? We have huge waiting lines in the ERs, and why people are going to all the wrong places when they feel unwell. So that's actually explained by a very, very simple but very significant fact. So based on our experience, which is currently serving over 22 million patients throughout roughly 12 years of Informatica's existence. So we did a study where it turned out that almost 3/4 of all patients actually have no idea on what type and level of care they need to engage with when they feel unwell. And this is where we try to help the patients understand their needs and their requirements better. And we also help the providers to actually see the patients which they actually need to see in that care setting. And so what we're trying to do is we're trying to meet the patients where they are at, whether it's through a self-service symptom checker tool, which could be integrated with your patient portal, with your website or mobile application. And in this case, it could also be connected, or it is connected to Salud on Clic's platform, which you already have, or it could also be connected to the other channel, which could be a nurse triage. So we are fully aware that not all of the patients have access to digital tools, or they're just not very tech savvy. So what we have was we also try to meet there at the other end, which is a phone conversation. So this is where we would provide this tool as a clinical decision support system for the nurse, who would be able to use it to support the patients in their care navigation journeys. And it's very important not to limit it to only certain types of diseases or symptoms. So that's why we're trying to provide a tool which is comprehensive in its nature, and it's not limited to only physical health, but we also cover mental health symptoms. We do not limit it for young or adults. And actually, myself being a young parent, so I've been a very active user of Informatica solutions to check the symptoms of my son before making any decisions on the next steps. I'm sure that many of you have kids of your own, and you know how stressful it might be when your kid is feeling sick and you don't know if you should wait till the morning, you should go to the ER, you should try to find some relatives who are doctors. So what I was doing myself is I've been using the symptom checker to analyze the symptoms of my son and to understand what are the most appropriate next steps that we should take. Besides this, we can take a look at an example of a patient journey. So I'm sure that many patients that you see in the ERs, and the numbers are very different, ranging from 50, and sometimes we hear even 80% of patients should not be in the ER. We also have patients who, let's say, self-diagnose, who maybe use Dr. Google, and they go to all the wrong specialists, making them unavailable for those who actually need their help. But we can think of this very simple use case, right? We have this patient, Carlos. He's a young adult. He has some symptoms. He's coughing. He's not feeling well, and he actually has no idea what to do. So, been there, done that. Typically, you would be left alone with all of these issues, and you would probably end up in a very not a very relevant care setting. But what you could have as an alternative pathway, so maybe our preferred state is you could actually provide an AI-driven symptom assessment tool for your patients, which they can use in the comfort of their home, right? So you don't have to go anywhere, you don't have to do anything. You just go to your patient app, you go to your patient portal, you answer a few quick follow-up questions about your symptoms, and you book a consultation based on a recommendation from the system. What's very important is all of this data is stored in your patient portal. So when you actually come to see a doctor, they already have some insight on your health, and they can quickly advise you on the next steps. Um, so let's take a look at a quick example of this solution and how it currently looks like. So it's typically embedded within your patient experience, within your patient portal. So you would go there, you would submit your demographic information, you would answer a few questions about your current state of health. So maybe you have hypertension, obesity, etc. We'd move on to submit your symptoms. So here it's very important that you have no limitation on the number of symptoms you can submit, or actually the type of symptoms. So even if they are not related between themselves, we'd be able to take into account all of them at the same time. We're also asking you about the region where you live or travel, and it helps us to adapt the regional epidemiology based on this. And following this evidence that we have collected, we'd move on to this dynamic AI-driven questionnaire. So here we would ask you a few follow-up questions, similar to like a real doctor does. And here we have a very interesting look at what the Informatica looks like under the hood. So it's basically hundreds of thousands of connections between the evidence that we're collecting, being risk factors, demographic information, symptoms, chronic conditions, etc. And based on this, we're ruling in or ruling out certain diseases. So after we follow up, after we ask a few follow-up questions, we would basically finish the assessment and provide you with an outcome of this interaction. This outcome being, first of all, a recommendation on what we call triage level. So what should you do? Should you take care of yourself at home? should you monitor your symptoms, or maybe should you talk to a doctor, whether it's an urgent consultation, whether it can wait for a few days. Should it be teleconsultation? Should you see them in person? Or, for example, it's really serious and you should go to the ER or actually even call the ambulance. So we would support the patient with all of this data. And yeah, in the meantime, while they're waiting to see a doctor, we can also provide some information on the common care methods. So what can you do by yourself while you're waiting to see a physician, or basically what can you do to prevent this disease from happening in the future, if applicable. And very important piece is that from this step, we would basically have a seamless transition of the patient into the next steps. So whether we recommend them to talk to a doctor or go to the ER, we'd be able to connect it to a call to action, whether it's a scheduling platform or a map of the nearest locations. So moving on, we probably can think of how safe is this tool. So we did a study, which is currently published in SciEdu, which is a peer-reviewed publication, where we compared our AI-driven assessment to Schmidt-Thompson protocols. So Schmidt-Thompson is one of the most well adopted and well recognized triage protocols in the United States, and it's widely adopted throughout the whole world. Um, some other alternatives could be something like Australian triage, or Manchester triage protocols for the ERs. But basically, our goal was to compare our AI assessment to the gold standard of triage. And what we found out it is that with a comparable, level of accuracy and safety of our solution, we're actually analyzing 4 times more evidence than the standard triage protocols. I guess the next question would be, do patients actually like this tool, right? Because as all of the innovative tools that you might add to your systems, adoption is very important. So based on a study we did with TK, which is the biggest statutory health insurer in Germany, which serves over 11 million members, we found out that the user satisfaction is actually close to 90%, and almost 80% of members declared that they will use this tool for the second or third time. Now let's talk about some of the more significant outcomes when it comes to the challenges that we have mentioned before. So in our partnership with the government of Australia, which is represented by a company, a government-run organization called Health Direct. So we did a study to figure out what's the impact of our solutions on the reduction of unnecessary ED visits or the general improvement of the care navigation pathways. So in the first 3 months of our cooperation, they had almost 50,000 patients calling in with the intention of going to the ER. So what we did is we redirected roughly 23% of these patients to a lower acuity settings, and almost half of all of the patients were directed to a lower acuity setting, whether it's a self-care recommendation, whether it's recommendation to do a virtual GP consultation, or just talk to your GP non-urgently. And something closer to your heart and closer to the Latin American market is our partnership with Medish, which is one of the biggest providers in Portugal. So they had a clear goal of improving the whole care navigation pathway for their members. So what we help them achieve is to increase the number of patients who actually opt for non-urgent cases, in some cases even do self-care, and basically by half reduce the number of people who go to the ER. So summing up, what a tool like this could help you achieve is to improve the whole care navigation, care seeking behavior of your patients, and to help them understand better the care settings that are most suitable for them based on the current symptoms, and to help you as the provider to better manage workload and provide higher quality services to patients who actually need them. Moving on to the second part of the equation. So after we already provided a recommendation to your patient what they should do, and let's imagine that in this case, we recommend them to schedule a consultation with your provider. So what else can we do to actually improve the process both for the patient and actually improve all the processes and efficiencies for you as the provider? It's very important that in all of these interactions, we do not forget about the data. So data is king. Data is the key to opening many other challenges and resolving any issues that you might have. So what we do with Anton and what we do with SAG is basically we collect the data from the symptom assessment and we put it directly into the patient profile. So at a later stage, when this patient actually comes to see a doctor, the doctor receives a pre-populated note with all the evidence we have collected from this patient, being their risk factors, so whether they have hypertension, obesity, they're a smoker, they have some allergies, etc. We're repopulating the symptoms which they started from, all the evidence that we have collected as an outcome of the assessment, so both the ones that are present and the ones that are absent, and the potential recommendation from the system. So here we're not only talking about a note with some evidence, but we're also talking about potential decision support for doctors that will serve the patients. So looking ahead at the question that probably not all the doctors might want this decision support piece, because I understand they've been training to become doctors for 10, 20 years. It's a huge responsibility and a huge burden to serve the patients. So what we can do is we can make it optional for them whether to see or not to see this decision support piece. But the main thing that we want to help them with is documentation. So now that you will have this note, you don't have to take additional notes. You have it all in your place. You might want to ask some follow-up questions and provide the diagnosis in a much faster and much more confident manner to your patients. And in this space, I would like to point your attention to a great case study that we have with our amazing partner from Mexico, Diagnosticare. So Diagnosticare is one of the leading providers of digital health services in Mexico. And by implementing this flow, where they not only guide the patients to the right point of care, but they also share this data with the doctors, they managed to reduce the average consultation time by almost 40%. So on average, the consultation went from 20 minutes to 12 and a half just by implementing this place. And what's the key? I think one of the key benefits from this, it's not only about the numbers, dollars and cents, but also the patients are happier because they now receive much more tailored and personalized care from their providers. But also providers don't have the burden of writing down the notes, putting down the tasks, etc. We might talk about the reduction of burnout among doctors because we all know that admin is one of the worst enemies of doctors. They don't like it. They don't enjoy it. I mean, I wouldn't enjoy it myself. So we can also think about let's say all sides of the equation in this use case. And having let's have like a quick look into the future. So currently we're talking about potentially different flows or different tools which are working on all of these use cases. We're talking about the pre-visit triage or intake collection. We're now also going to work on a use case which would automatically follow up with the patients who perform the triage and to check on them automatically on how they're progressing, whether they do or do not need any other attention from the doctors. But what we want to achieve is we want to leverage the latest developments in Gen AI and LLMs to create pretty much your health agent, which would be a conversational all-in-one tool with whom you can communicate seamlessly, which can answer any question that you might have about your health concerns, and which could help you help basically become your health partner in this journey and help you understand when you need an appointment, who you need it with, how can you better prepare for the consultation, and also this agent would be able to keep track of your health in order to make sure that you're recovering from the symptoms, recovering from the disease, and basically would take your hand and lead you from the first step of your journey and up until the moment that you're feeling well. So I will quickly show you um, the prototype of our AI health agent, which would be a fully conversational tool. So you can see the difference between the one I showed you before, which was more of a Q&A, a static flow. Here, you'd be able to fully, seamlessly, and fluently speak to this agent as you would to your doctor or to your friend. So you're not limited to some questions or some options. You can answer in your own words. You can talk to it. You can correct your own symptoms. And one of the key, I think, areas in this tool, one of the highlights is the full transparency of the tool. So we show you what are the evidence that we have collected, what is the thinking of the tool. So in which direction is it going? So what are the most possible conditions we're currently considering? And basically, you'll be able to trigger this at any point of the conversation. So just like you would ask a doctor, the doctor, why are you asking this, Laura, right? So what kind of what diseases do you have in mind? So in this tool, you'll be able to trigger all of it, and basically you'd be able to have a full, proper conversation with the tool. First, we should have it available in a chat-based form, like you see it currently. But as a next step, we're also going to release it as a voice bot. So whether you want to have it just like as a voice bot in your chat, or you want to call and to have it as to have the tool as a nurse assistant, we'd be able to do all of it seamlessly and fluently. Um, so that's it from my side. Um, I think we're I'm sorry. So still flu season here in Poland. Thank you all for your time and for your attention. So I'm waiting for any questions that you have, and yeah, looking forward to it.
Thank you, Vlad. Muchas gracias, Vlad. Creo que, bueno, ha sido muy conciso los puntos donde la inteligencia artificial puede ayudar a resolver problemas en los procesos administrativos. Muy interesante cómo puede ayudar a reducir los tiempos, ¿verdad? De la consulta, que es un tema que es cierto, se pierde en la consulta tradicional, consultando los síntomas y demás, se pierde muchísimo tiempo, además que la tecnología basada en evidencia da un prediagnóstico que al final el médico toma la última decisión si lo considera o requiere ajuste. Muy interesante todos estas innovaciones de conversacionales, porque se puede, estos nuevas tecnologías de machine learning le permiten al bot aprender del paciente, entenderle y con su información integrada al expediente digital, le permiten también navegarlo mejor en sus necesidades. Eh, bueno, hemos estado recibiendo preguntas. En los que no las han enviado pueden todavía utilizar el código QR. Son muchas preguntas, entonces vamos a tratar de consolidarlas y vamos a empezar con la primera. Nos preguntan por qué debo de confiar en la inteligencia artificial y cómo esto realmente no me sustituye o no me cambia como un profesional de la salud, me reemplaza por esta tecnología. Entonces, eh, bueno, ¿y por qué debo confiar en Infermedica en este caso? Yo puedo agregar que para mí Infermedica es una de las mejores tecnologías en el mundo en esto, tienen mucha experiencia. Pero Vlad, ¿por qué? Why we should trust AI and why we should trust Infermedica?
Mhm. Yeah, thank you. Thank you. It's a great question. Probably the question, why should we trust AI, is even a bigger one than why should we trust Informatica? Because with all of the developments, with all the latest developments in LLM specifically, so probably everyone has tested ChatGPT or Gemini or Claude or something else. So many of you probably stumbled upon hallucinations, stumbled upon some weird answers when you're asking about one thing and it tells you that the weather is nice. Well, when you ask about some symptoms. So it's a very valid question. It's a great concern for everyone, and it's obviously always been a great concern and one of the key questions for us. So how can we make it trustworthy? Well, first of all, our technology is developed by doctors. So currently we have a team of roughly 40 doctors working on the solution, and their job is to manually curate medical content from medical publications, literature, and journals in order to create this concept in our medical knowledge base. So first, it's hand curated by real doctors, and it's based on evidence-based literature, right? Second, um, our solution is tested both internally, so it's always validated by these doctors, and it's also validated externally by our customers. So you can imagine when, for example, the government of Australia or the government of El Salvador, who is also our customer, wants to onboard a solution like this, they typically perform a rigorous evaluation and validation process. So this is where we also improve, we receive valuable feedback, and we improve our own algorithms. And also, probably last but not least, it's very important to note that um, our solution is not, let's say, based off the LLM solely. So the main difference between, let's say, ChatGPT and Informatica solution is that we are fully explainable and predictable. So what it means is the solution, so from Informatica, does not hallucinate. It works on probabilistic reasoning, so it cannot physically hallucinate. And if you, let's say, if you submit the same evidence, it will always reach the same outcome. So it's predictable and it's also explainable. So each and every interaction with the solution can be backtracked. We can look at all the questions we ask. We can look at the reasoning from the engine and why certain questions were asked, why it went into certain direction. And so it's always easy for us to identify any potential spaces for improvement or any issues, if any occurred. But basically, let's say to sum up, it's a system created by doctors. It's transparent, it's explainable, it's predictable. So there is no way of how it could hallucinate or provide some irrelevant guidance or irrelevant information to the patient. And even when we do use LLMs in this new let's say Informatica 2.0 solution, which I just show you with the conversational flow, we only use the LLM for the conversational piece. So it only is responsible for talking to the patient, but not for medical reasoning. It's still used by the medical knowledge base created by our doctors. And I think we can basically compare it to the mouth and the brain, where an LLM is just the mouth and the whole brain is powered by Informatica and our own team of doctors.
Ya, creo que, bueno, esta definitivamente es fundamental y es una de siempre de mis preocupaciones con estas tecnologías, que quién está detrás de ellas, porque estos agentes hoy en día, eh, depende de quién los entrena, así responden, ¿no? Por eso esta parte que nos explica Vlad de que está revisado y validado por expertos, médicos especialistas en cada área, inclusive en enfermedades tropicales para temas como dengue y chikungunya. Esto genera más confianza de parte de los usuarios y lo hemos visto en México y en El Salvador. Perfecto. Bueno, la segunda pregunta es muy interesante. Eh, I can take this one, Vlad. Es cómo implemento esto en mi práctica cuando ya tengo sistemas o expedientes y qué costo realmente esto implica para mi operación. Es una pregunta muy importante porque todas estas tecnologías eh, pueden generar una fricción o un rechazo de alguna manera por parte del personal médico en capacitación, en uso y demás. Sin embargo, esta es tan intuitiva y balancea las cargas de trabajo, o sea, incorpora al paciente en la ecuación, incorpora el call center también en el proceso de triage de síntomas. Y esto hace que para el médico más bien sea más sencillo ver el resumen de por qué usted está aquí, ¿no? Y no empezar a hacer toda la entrevista, que igual la puede hacer, la puede validar, pero no tiene que hacerla desde cero. Luego, en términos de costos y procesos, pues va a depender mucho de qué nivel de automatización o de proceso quieran implementar en la organización. Para los que ya usan Salud a un clic, esto ya no tiene un costo de integración, ya está embedido en la plataforma. Sí hay un costo de uso, pero son centavos por transacción que se ven compensados por mucho más, que es el tiempo del médico, el profesional y el servicio. Entonces, nosotros, bueno, somos muy contentos de este partnership con Infermedica y con el equipo de Vlad porque sabemos la calidad que se recibe y el retorno es menor que el costo de la implementación y la inversión. Entonces, sí, no hay que reemplazar sistemas. Los que todavía no usan SAC lo pueden usar también con otros sistemas, si fuera el caso. También les podemos colaborar en eso. Muy bien, la pregunta número 3 es si la inteligencia artificial también toma en consideración aspectos epidemiológicos locales o regionales a la hora de dar estos diagnósticos y estas evaluaciones del triage. Vlad, this is yours. Does the AI take epidemiological and regional health data consideration for the process?
Yeah, thank you. Thank you, Anton. Yeah, so absolutely. So it's very important for us as a company who works in over 35 countries around the world to be able to provide at least a certain extent of localization for our users in various parts of the world. Since we're present from Latin America to Europe to Australia to Asia. So what we do is our doctors, they put some of the regional risk factors, especially such as epidemiology, into our medical knowledge base in order to trigger the prevalence of certain diseases when the user selects, for example, Latin America as a region. So we already have it to a certain extent. And what we also do for some of the projects. So, for example, we did it with Australia. We did certain localization for El Salvador, which is even more relevant to you. Is we did even a deeper localization of our medical content, where basically we would study a deeper level of prevalence of those diseases in the region, and we would have to adjust our engine and how it's thinking according to our findings. So absolutely, it's a great question, and we do invest into this direction. And obviously, if, for example, any of you find any other space for improvement after using our solution, we are very happy to take any feedback that you have and explore how we can improve our solution even further.
Thank you, Vlad. That's amazing. And I actually tried the use cases with dengue and a common flu, so it's really interesting the precision. Um, all right. La pregunta número 4 es ¿qué sucede en casos donde se usa telemedicina y cómo esto puede ayudar a estos procesos que son totalmente virtuales? So Vlad, if you want to answer to how this can help the telemedicine consultation as well.
Mhm. Yeah, so it's a great question, and we do work with quite a few telemedicine providers or just providers who offer telemedicine as one of the options for their patients and members. So I think here we can look into this from two angles. First one is the care navigation, obviously, right? So the first topic of my presentation, and I think here we can think of how can this symptom assessment help me actually guide more patients towards teleconsultations. which are a bit more um, time efficient, cost efficient. Um, Typically, it's a better experience for the patient themselves since they can do it from the comfort of their home and actually receive the same outcome. So our solution can be one of the channels, one of the tools to help you improve the adoption of teleconsultations. And we also have some great outcomes. We have some great case studies on this, which we will share in the end. So where we helped some of our customers in Portugal, in Poland, in some other countries around the world to improve the adoption of teleconsultations. And sometimes it was even an increase of roughly 30 to 40% compared to the previous periods without a symptom checker. And I guess the second point of view we can have on this topic is what else can we do to improve the process, right? And here, obviously, connecting it maybe to the second topic of my presentation, which is optimization of the process and especially the data processing and connection. So we can obviously collect all the data from the patients before they see a doctor and potentially help to reduce the time of consultation even further and improve the process for both parts, right? So to have even a better experience for the patient who can receive a consultation maybe in less than 5 minutes, because that's what we see some of our customers do.
Awesome. Thank you so much, Vlad. Muchas gracias por la respuesta. Y bueno, la última pregunta que vamos a poder tomar por cuestiones de tiempo y respeto a todos los que se conectaron el día de hoy es la más controversial. ¿Cómo esto realmente me garantiza o protege la privacidad de los datos del paciente? ¿Y cuáles son los aspectos de regulación local que está sometido a todas estas tecnologías y el manejo de datos del paciente? Bueno, esto es una pregunta muy interesante porque tiene varias connotaciones y tal vez depende mucho desde dónde nos estén mirando, desde qué país. Hay algunos países que ya tienen cierta regulación en el tema de inteligencia artificial en salud, algunos que apenas están iniciando. Sin embargo, todo lo que se ha presentado hoy realmente no altera o no va en contra de ningún proceso clínico actual legal en los países. Es decir, no se está reemplazando la práctica clínica, se está asistiendo a la práctica clínica, no se está recomendando al paciente tomar decisiones sin su médico, ¿verdad? Sino más bien es un apoyo tanto al médico como al paciente de poder navegar el sistema. Entonces, esto por un lado. Y en relación a la seguridad de la información, todas estas tecnologías, tanto Salud a un clic como Infermedica, están en servidores alojados que cumplen con los estándares de HIPAA compliance y protección de datos del paciente. También nosotros recomendamos incluir términos y condiciones, como es un servicio innovador. Es importante, nosotros también tenemos ya esto en nuestros borradores y los incluimos y se los facilitamos a nuestros clientes con todo el gusto para que estos términos y condiciones todavía especifiquen más los alcances y responsabilidades de cada una de las partes, para que legalmente todos puedan trabajar tranquilos los diferentes proveedores tecnológicos, al igual que los proveedores clínicos y, bueno, los hospitales y centros de salud. Entonces, bueno, hay mucho por trabajar en esto. Sin embargo, hemos estudiado con mucha responsabilidad esos aspectos de privacidad y de manejo de la información y la regulación, y no hay ningún incumplimiento que se esté violando ni se esté buscando reemplazar el acto médico, el acto clínico que es tan importante. Entonces, bueno, ya vamos cerrando. De verdad, estamos muy agradecidos por esta sesión. Hemos querido ser lo más específicos posibles. Creo que ya ha sido claro cómo esto nos ayuda a navegar al paciente, cómo mejora la eficiencia, la efectividad de los datos del paciente y cómo podemos crear una mejor experiencia, ¿no? Tanto para el paciente como para el proveedor de salud. Los que están interesados en tener un apoyo diagnóstico a las primeras 5 hospitales o clínicas que nos contacten. Les vamos a dar una asesoría gratuita con expertos en inteligencia artificial para los que quieran rediseñar un proceso de atención clínica. Y bueno, tienen nuestra información de contacto a través de Salud a un clic, y muy, muy contentos de poder atenderles en otro espacio de reunión. De verdad, thank you so much, Vlad, for your time. Thank you, Alexandra, for your time as well and for coordinating this. We're really excited, and I was saying that we're waiting for the feedback of the different hospitals and clinics to start working with them implementing these amazing technologies.
Yeah, thank you, Anton, and muchas gracias por su atención. That's the best I can do for now in Spanish, but I promise everyone that next time we have a webinar, I'll try to speak Spanish.
Oh yeah, and it's
Thank you,
important to
everyone.
say that all this is in Spanish, so the demo was in English, but everything, todo está traducido al español y todo esto funciona en español. So Vlad will improve his Spanish, but the app already works and the technology works in Spanish. All right.